Good morning. Good morning, everyone. Welcome to Kindness Rising. Today's a little different. We're going to go a little deeper because we aren't talking about kindness as a feel-good gesture or community change or business strategy. We're talking about a lifeline because mental health equity, it isn't a luxury. It's not optional. It's a kindness imperative.
This is Kindness Rising.
Good morning, everyone. Recently, I had the chance to read a really important document. It's called Reigniting the Flame, a manifesto on mental health equity. And it enlightened me about the inequities in access to mental health care throughout our community. This episode, we're going to examine how communities are working to create equitable access to mental health resources and social support. We're going to highlight innovative approaches to addressing systemic barriers and celebrate advocates that are making real change. So let's get to it. Mental health struggles, they diminish our capacity for kindness, for compassion, and for understanding. But it's even a matter of life or death. When people can't access care due to systemic barriers, it leads to some really nasty outcomes. We're talking about substance abuse, unemployment, homelessness, violence, and suicide. Let's take suicide for just a second. My sister, who's a mental health counselor, she's actually a clinical psychologist in Rochester, is very focused on this. She does a lot of advocacy related to suicide, and her work has enlightened me and raised awareness with me. And that's what we're doing today here on Kindness Rising. We're raising awareness so that we can make change and address the problems of suicide. Here's the thing: middle-aged, heterosexual white men, they account for the largest segment of suicide deaths. But data on other populations indicate that it's a really rising problem. And the issue is direct access to care. That's a barrier to people receiving what they need in order to prevent the scourge of suicide. Suicide rates among Black youth aged 10 to 19, it increased 144% between 2007 and 2020. And there was, and that's even a far steeper rise than those in white communities. Suicide is the second leading cause of death among individuals aged 10 to 14 and 15 to 24, with rates increasing sharply over the past decade. And LGBTQ plus youth are more than 4 times likely to attempt suicide compared to their non-LGBTQ plus peers. We have a real problem related to access to care for mental health for populations, particularly those that are in the non-white and non-heterosexual community. According to the American Psychological Association and the U.S. Census, only about 17% of licensed psychologists identify as people of color. Certain segments of the population, specifically Black and Hispanic adults, they're significantly less likely to receive mental health treatment than their white counterparts, even when we control for things like income and insurance status. And Latino adults and Hispanics are right there with them. So how does mental health equity and inequity connect to kindness? The answer is really simple. Kindness is at the core of empathy, compassion, and understanding. And it's about recognizing shared humanity in each of us and extending support where it's needed most. People who lack equitable care in mental health struggle. They struggle in silence. They're unable to fully participate in their communities and even experience joy in the giving and receiving of kindness. And it isn't just a personal struggle. That has ripple effects across our families, our workplaces, and our society as a whole. It's not just unfair, it's a fundamental impediment to a life filled with kindness in a community that grows and thrives. Imagine trying to navigate your life, maintain relationships, and pursue passions while silently battling anxiety, depression, and significant trauma. The energy and emotional bandwidth that's required for that kind of a fight often leaves room for little else. And it's difficult to extend kindness when you're fighting an internal battle, and it's even harder to receive it when you feel isolated and misunderstood. So today, we'll do our part to raise awareness, and we'll open the door to kindness through understanding. Welcome. This is Kindness Rising. We're going to move now to our kindness spotlight. This is where I highlight organizations that are doing their work, doing the hard work, the good work for good people to raise awareness and address the issues that impact our society. And today, we're talking about the issue of inequity in mental health and the impact that has on our lives. There are two organizations we're going to talk about today. The first is Mental Health America, and then second is Lady Gaga's Born This Way Foundation. These are two great organizations that are doing the hard work of raising awareness and addressing the issues of suicide and mental health problems in our society. So let's talk about them. First, we'll talk about Mental Health America. This is one of the largest nonprofits in the United States that's focused on promoting mental health, preventing mental illness, and ensuring equitable access across our populations. They're doing the really hard work of rising above the noise. There's so many issues in our world. They are the ones who are focused on making the big systemic changes that need to happen in our society to ensure equitable access to mental health. Every year they publish their studies, the state of mental health in America. This report highlights those disparities that we talked about before, highlights the problems, spotlights the issues that are going on in the world, and that data itself is huge for advocacy at state and local governments implementing policy change. But they also do practical work. They have one of the largest screening programs in the U.S. Their local, state, and local agencies within the national organization. We have one right here in Binghamton called the Mental Health Association of the Southern Tier that's doing the great work of addressing our local populations through screening programs, through education, awareness, and most importantly, that policy change. Visit the website of Mental Health America. You will learn more about them. I was actually planning to share my screen today, but I'm gonna skip over that actually for this portion. But anyway, Mental Health America. Visit their website, donate, volunteer, educate yourself, educate others. That's what we can do. That's what I'm doing here today. That's what we're trying to do at Kindness Rising, and what you can do to help this issue. Learn about it and educate others. Spread the message about mental health inequities and mental health needs in our communities. That's what Mental Health America does, and that's what we'll do. Want to talk about Lady Gaga's Born This Way Foundation. Actually, I do have their website up, so you can watch their little scroll here about what they do. But Lady Gaga, it's no secret that she's had her own issues related to mental health. She understands, particularly within the LGBTQ plus populations, the issues related to mental health, with regard to access to care, with regard to being open, with regard to being brave and being accepted in our families and our communities. And Lady Gaga, along with her mother, Cynthia Germanata, in 2012, as part of their dedication to this population, started the Born This Way Foundation. Their mission is to empower young people to be kinder, to be braver, and to open up the world for mental health improvements. They have tons of initiatives going on. Visit their website. They're supporting research. They're grant making. They have partnerships in the organization. One of the most important ones, particularly for me, is I have two kids who are heading back to college, is their Timely Care program. It's a program that they fund, that they directly support in our colleges and universities where kids can get access, actually young adults can get access to mental health care on college campuses where it's needed most so that we can fight against the problems of suicide, of self-harm, of violence, of isolation and depression, anxiety, all those things that come along with some of the changes that happen, particularly for people this age. Lady Gaga's personal story is an inspiration for this, and she and her mother are getting after it through their Born This Way Foundation, helping to address these issues. Check them out. Visit their website. Support their work. Both of these organizations are a testament to the power of collective action and the unwavering belief that kindness, compassion, and equitable access to care can truly impact our communities and transform lives. I encourage you to visit their websites, explore their initiatives, donate when you can, because every act of support, no matter how small, contributes to these vital causes. Thank you for listening to Kindness Spotlight. Let's move on now. I'm going to check in on the comments real quick. There's a couple of people out there. I appreciate it. Global, I appreciate you. I see that you've joined and subscribed to the channel. Thank you very much. Every subscriber here helps us to expand our message. Mike Sullivan out there on the West Coast, appreciate it. Grateful for another day of kindness that always snowballs into more kindness. I love that. That's the point of what we're doing here. Each of us that reaches out through our small acts of kindness can help to grow within our communities and make change. You also mentioned the Costco, and you're going to be shopping there. That's not the point. The point isn't for me to drive you to those businesses, but I appreciate that, Mike, and I appreciate that we're going to support those organizations that are leaning into the good work we're doing here at Uncommon Kindness. And Be Driven, you're here again today too. Thank you so much for your ongoing support. I sent you a little message in the DMs yesterday. I know you've been talking to Keith about some things too. I'd love to connect with you after the show and talk about what we're doing here. I know we have connections that can help outside of the program. That's what's going on here. We're building a community of people who lean into kindness, who wake up every day and get after it, doing good work in the world. You're a huge part of that. Thank you, Bernard and Mike and Global and all the people who are out there listening and taking action, most importantly, which is what we're going to shift into now with our kindness compass. Gets me going every time. But anyway, this is the kindness compass. It's where we talk about specific actions, practical things that we can do to apply ourselves and work hard together to fight against the problems of mental health inequity. Because mental health is health. We want to dismantle the stigma around mental health and the issues of barriers to care. We do that through open conversation. The Mornings in the Lab Network and the Business Athletes Performance Lab and Kindness Rising are all about having conversation, live conversation that drives change. We're talking about it. We're sharing our struggles when we feel safe, and we're educating ongoing about the issues that affect us every day. So welcome to Kindness Compass. I'm going to take Lady Gaga off the screen. Well, her stuff is really important. I am going to move along here with the program. Thank you all. As you know, we lean into progress, not perfection here. Sometimes I don't click off the right clicks and do the things that need to be done for the program, but my message is clear. We have to act aggressively, proactively in addressing the issue of mental health equity. And today, I talked about it in the beginning, that manifesto for mental health equity that I read about. You can go out on LinkedIn, in particular, a gentleman named Kevin Dednar, Dednar. He wrote this article, and it was really impactful for me. And I'm going to talk about it and read a little bit of what he wrote so that we can all learn and grow together. His manifesto for mental health equity provides a handful of really clear steps of action that we can take together and the world needs to take in order to address this issue. Let's start with equipping children with emotional and mental health skills. In 2021, the U.S. General warned of this youth mental health crisis. Between 2011 and 2021, the persistent feelings of sadness and hopelessness among high schoolers jumped by over 40%. Suicide among teens raised by 50%. For children of color, often navigating things like racism, economic instability, and community violence, that burden is even heavier. We must teach emotional literacy early and often, not as a resilience mantra, but as an act of liberation. Those are Kevin's words. They're not mine. But he's encouraging curriculum to be developed and executed for culturally relevant, trauma-informed, and community-rooted care to stop treating trauma as inevitability. I love that. It's not inevitable. We can fight against it. His second mantra, his second item for action is diversifying and expanding the mental health workforce. I talked about it earlier. 17% of licensed clinical psychologists identify as being non-white. This is a major problem. When we don't identify with the people who treat us and who help us, it's a barrier to access. We need to invest in talent pipelines that bring more Black, Indigenous, and people of color into the field. It requires investments in scholarships, fellowships, mentorship, and it means that we have to adopt frameworks like cultural humility and racial trauma-informed care as part of those professional standards. He also encourages us making interstate licensure work for people, not against them. It's a major issue. A lot of people, particularly on the borders of state, I sit on the border of of New York and of Pennsylvania. Having the ability to cross borders for these providers will increase access to care. It demands regulatory innovation, state and federal agencies to fast track solutions that enable trusted providers to cross borders because even all the advancements that we've had in technology that enable mental health care through Zoom calls and all these platforms that are out there, providers are not allowed to treat outside of their state. So what that means is if I'm sitting in New York State with my license in New York State, and I've got a person out in Ohio that connects with me, that understands me, I'm part of that 17 to 18%, I can't treat them and get paid for it. That's not fair. It's a barrier to access. He also talks about closing the digital divide. Populations that are experiencing poverty, inner city populations, and particularly rural populations even face this issue of digital equity. Some of us, we take it for granted that we'll have access to broadband services. And if we need to access things like what we're doing today here on YouTube, we can do that. But there are tons of population out there that don't have access to broadband, and that impacts access to care through those digital platforms that we talked about. Guaranteed access regardless of ability to pay. It exists in our emergency rooms. It does not exist within the mental health community. So people who are impoverished, particularly youth who don't really have a say because they might not have the ability to earn income, and their families are struggling. They need to have access to care too, regardless of their ability to pay. There needs to be structural changes. It's not about just coverage. It's fundamental. It's cultural. And so looking again at those regulatory things that cause these barriers to access is vital. We want to end the stigma and rebuild trust. That's huge. That's what we're doing here on Kindness Rising, is talking about these things, talking openly, sharing our stories when we feel safe and comfortable. These are vital. There's so much stigma still around mental health. It's expanding and it's growing in terms of its acceptability. We know research has shown that access to mental health care will improve our communities, will reduce those rates of suicide, of violence, of homelessness, of unemployment, all those things that cause problems in our society. But when we don't talk about it, when we don't feel comfortable talking about it, it's a barrier to care. It's essential in marginalized community in order to build systems that heal and help people thrive in their community. That's today's Kindness Compass. A few practical things, a few systemic things. That's really the key. We can act personally, but we have to cause systemic change to happen in order to really address these issues. So thank you. Thank you for listening to the Kindness Compass. Next, I want to move on to the Kindness Call. As we do here every day on Kindness Rising, we want to move from thought to action. I got a little heavy with data today because I really wanted to reinforce the issue that's going on here. We need to understand that in order to move forward, but we also have to act. That's the key. Just talking about it is a good start, but we have to act. And that's why I bring Kindness Call every day, a chance for us to move from thought to action on the issues that we address here on Kindness Rising. So welcome to the Kindness Call. I'm going to check back in on the chat real quick and see how things are going. It looks like we have some new action, some new activity going on in the chat. Appreciate it. Asiatic 777, welcome to Kindness Rising. What happens if you're demon possessed and not insane, and you're serious, you're not playing? Well, I think that that's quite an issue. I would suggest that we get out there and talk to people about that. It's one I hadn't thought about specifically, but I appreciate that you came here and you shared it. Talk to your family, talk to your clergy, talk to your mental health providers, and I'm hoping that they can help you. Mom, you're out there too. Good morning. Good morning. Thank you for helping everyday people to open their eyes, ears, and hearts to tackling mental health issues. Thanks, Mom. You know, Lisa and I are focused on this together. Lisa's my sister. We're focused on this together. We've had our own experiences with it, both personally and with amongst our community, and we're out there addressing it. Thanks, Mom. Appreciate it. And you said good morning to our new friend, Global, Asiatic, Mike Sullivan, Be Driven. My mom's out here every day impacting and addressing these things. So thanks, Mom. And Inside the AI Labs is here today. So you appreciate that. Apparently, what's up, Keith and team? Appreciate you. Keith is expanding his program, Mornings in the Lab. Now goes from 8 a.m. till 11 a.m. with that last hour from 10 to 11 talking about AI specifically. We're leaning into it across the world. We're here to help you, all people, to use AI to improve human connection. It's a partner for us in growth. We've got some programs to help you to leverage AI. If you're interested in how you can use AI to further your mission, reach out to me, reach out to Keith. We're here to help. Check out the awesome stuff that we're doing out there on YouTube, and continue to learn and grow. We're going to launch a new program. Keith is educating. We're going to do a formal program related to AI, a chance for people with a little bit of investment to learn even more how AI can help us to expand our human connection. Keep an eye on it. We're doing some amazing stuff here on the Mornings in the Lab Network and Business Athletes Performance Lab. So thank you very much. So back to the kindness call. Appreciate all of you. We're going to move to thought to action. We're calling this one our Open Door Kindness Challenge. We're getting into what we can do personally. Take a minute. Reflect on your own mental health well-being. In order for us to help others, we have to help ourselves first. If you're struggling with mental health, demon possessions, Asiatic, whatever those things are, we all have issues that arise in our lives. By proactively addressing our mental health issues, doing it before we have the need, we will be stronger when the need comes. So think about it. Think about yourself and how you might want to access mental health services. More importantly, we drop our egos here on Kindness Rising. Check in with someone else in your life. Just ask them genuinely, openly. Listen, how are you doing today? Not just, hey, how you doing? How are you doing today? Be aware of changes that are happening in the people around you. Watch for behavioral changes. Watch for the words that they use. Think about what they're saying and encourage them to access mental health care. There are lots of opportunities. We want you to get out there and do that. So that's a simple check. Check in with yourself. Think about how you're doing. Be conscious and intentional with your thoughts about yourself and your mental health. Be conscious and intentional with your listening to others. And together we can rise through these mental health challenges to help people to live more fulfilled lives with more compassion, more empathy, and ultimately more kindness. Thank you very much for listening to the Kindness Call. Get out there and act. And that's today's show, essentially, right? We're winding down on our day here on Kindness Rising. I encourage you to stick around, to go over and check out the Mornings in the Lab Network. The key takeaways for today: the journey to mental health well-being is unique for every individual, but no one should walk it alone. We have to address the inequities that we have in our systems related to mental health access. Advocacy at state and government, reducing that stigma in our communities, talking about it, supporting those organizations like Mental Health America and Lady Gaga's Born This Way Foundation that are working hard to address these inequities. We have the power as a group. We're building a community here. Thanks for sticking around and helping to build this community. We appreciate it. Remember, sharing is caring. So get out there and share in the comments, get involved, take action, support each other, share your story when you feel comfortable and safe to do it. It's going to help somebody else. Thank you for joining Kindness Rising this morning. I appreciate and I care about each one of you personally and all of us as a group, because together we can rise with kindness, hope, humanity, and heart. Thank you very much for listening to Kindness Rising. Join me tomorrow, 7:30 a.m. Our theme tomorrow is going to be large-scale social impact. We're going to talk about how and that connects to access to care, and continue to get at it with consistency, humanity, hope, and heart. And as we always say, stay uncommon and stay kind.